Your general flow and structure, I've explained in detail your grips. So now you know how to introduce yourself and you know what kinds of introductions are needed in different kinds of situations. Your history taking we'll talk about. You will either use the presenting complaint history taking of Socrates or Fodi Para. And then you do need to do a background health P. maftosa, then the examinations. You then need to explain the examination findings to the patient and work out a provisional diagnosis, a differential maybe, define, okay, the diagnosis and investigations that will lead to a diagnosis followed by management. So make sure that you know that this is your structure in general. Why don't we talk about each of these in detail? The presenting complaint. We'll start this after a short break of about 10 minutes. After 10 minutes, we'll begin and we'll talk about the presenting complaint history at 10:30 a.m. Thank you. Okay, guys, we're back. This time we focus on history-taking skills. When it comes to history-taking skills, you have 3 P's, the P3, maftosa. So for the presenting complaint, you will use odipara, but I like to add an F and say fodipara for frequency as well. Any intermittent symptom needs a frequency. How often do you get these symptoms? You will ask about the past medical history, and sometimes you may need to do a personal history, and we will discuss what personal history is. We'll go through everything. Let's start with odipara or Socrates, and then doing your differentials. The onset, duration, progression. When did your symptoms begin? Did it start suddenly or gradually? And since it began, are your symptoms getting worse? Are your symptoms on and off? And if they are on and off, ask the frequency. Have you noticed anything that brings on your symptoms or anything that makes your symptoms worse? Have you noticed anything that makes your symptoms better? And now you start asking the differentials. So it's a very straightforward and thorough beginning to your presenting complaint. And I think most of us will be able to be good at this by making sure first we memorize the questions properly. They need to be fluid. They need to be fluent. You don't have time to be thinking about each of the questions. They have to come fast. Socrates will be asking about the site of the pain, the onset of the pain. How can you describe the pain? So where's the pain exactly? Can you point with one finger? And how did it begin? Did it begin suddenly or gradually? Character, can you describe the pain? And does your pain go anywhere? Now, associated symptoms, you can ask, have you noticed any other symptoms? But usually by doing your DDs, you can obviously cover that. And there are other skills. So you ask about the timing. Is your pain constant or on and off? Again. You ask, have you noticed anything that makes your pain worse? Anything that makes your pain better? And now you're paying attention to positions maybe, or different kinds of things. It depends on where the problem is. So today we'll be doing cardiovascular first. And you'll notice that what you need to pay attention to somebody who has chest pain might be the radiation of this chest pain to the neck, to the shoulder. Also, if the pain is everywhere on the chest, exacerbating and relieving factors can give you clues. For pericarditis, they could have pain that is worse than lying down, better when leaning forward, because when they lean forward, the pain feels better, and they may have had a flu-like illness in the past. So you can ask about that as part of your DDs. Have you had any flu-like illnesses in the past? So there's many, many different scenarios that we will be going through, and there are clinches on how to ask about them. If somebody comes with chest pain, and they also have shortness of breath, and I need to do the differentials for PE, I will ask about a cough. I will ask about signs and symptoms of DVT, swellings in the legs. okay, any pain in the calf. And so you already know that these are going to point you in the right direction. In your past medical history, depending on what you're looking for, you do have to be specific as well. Sometimes you want to know if they've ever had any clots before. If you're doing a risk factor assessment for somebody, you may need to ask specifically and signpost, is there any chance, I'm sorry to ask you this, is there any chance you could have had a heart attack in the past or any heart problems? Do you have any medical conditions such as high blood pressure or high blood sugar? Have you ever had any heart problems in the past? Sometimes we go deeper. We ask about admission. We may ask about immobility, depending on the things we are assessing as well. Have you ever had any operations in the past? If you're doing a pre-op assessment, you would add things like anesthesia. Have you ever reacted to anesthesia in pre-op? Yeah. So just some examples. You need to know the baseline, and then you, over time, as you practice, will know the specifics as well for each kind of situation where the most relevant history is. Because you have 8 minutes and you're required to do things in a timely manner. If you ever had to take personal history, you need to know what personal history is. A common misconception is that smoking and drinking alcohol are permanent histories. They are not permanent histories, personal histories. So you don't need to say, I'm sorry to ask you this. Is there any chance you smoke? I want to ask you a bit of a personal question. Do you smoke? Do you drink alcohol? In UK culture, these are normal. And if you actually say that, you may actually be telling them that, oh, you should be embarrassed about smoking or drinking, when to them, it may not be. It could hurt your IPS. So let's know exactly which questions are personal. Yes. Is there any chance you use recreational drugs is a personal question. You need to say, I need to ask you a bit of a personal question. Is that all right? Is there any chance you use recreational drugs? You have to signpost. If you're taking the sexual history, it is personal. You need to take it at the right times. So please be non-judgmental, uncomfortable with your sexual history. And so your body language is a big part. If I haven't already told you, your body language must be that of a doctor. So why don't I stop sharing for a second and I show you myself what that could look like in terms of how you sit and everything. So first things first, we're here. We're sitting nice, straight back. The chair needs to go all the way. Your buttocks need to be with the chair. Sit comfortably, and your hands now, they need to express themselves as they speak. So if my hands, we don't want them too high, we don't want them low, we don't want them between our legs, we want them here. We want them around the abdomen, lower than the chest, higher than the hip, in the middle. Your hands, don't make them agitated. Don't make them look as though you're scared. Any chance we're moving the hands? We're actively listening. Okay, so I just need to ask you a few personal questions about your sexual life. Is that okay? These questions will allow me to assess the risks of your sexual health and be able to help you better. If at any time you don't want to continue, please let me know. May I ask, are you sexually active? Your hands are always moving. Sorry. Let me open. Okay, we're back. So again, this is day one of the course. We're going to be going through history taking, and also we're going to do scenarios through the day. The session will run until 6:30 p.m. today, with lunch break between 1:30 and 2:30. And obviously, we'll be covering cardiovascular, respiratory, and hematology for the first day as well. So your sexual history. When you're doing your sexual history, please be non-judgmental, comfortable, and ask very, very easily, are you sexually active? Is your partner male or female? Do you practice safe sex? By this, I mean, do you use condoms? You need to ask what kind of sexual intercourse do they usually practice? Is it oral, anal, or vaginal sex? Is what we want to hear. And you need to make sure you actually ask. Good. Ask when was your last sexual intercourse? Ask, is there any chance you could have had more than one partner in the last 6 months? Or let me remove this for you. And that's that. How many sexual partners have you had in the last 6 months? Have you traveled abroad recently? Is there any chance you could have had sexual intercourse while abroad? If the answer is yes, you need to ask, what kind of sexual intercourse? Was it oral, anal, or vaginal? And then you need to ask, did they use a condom? Good. Sometimes we want to ask about the relationship. It's important. Why? Because we need to then see if the STI potentially could have been transmitted to the partner. So we ask if they're in a stable relationship, or we ask if they're married. Okay. We also ask about any previous infections and testing. Have you ever been sexually tested for sexually transmitted infections before? Have you been tested for other STIs in the past? We ask about symptoms in the partner. So excuse the small spelling errors. Symptoms in the partner. I just need to edit this as needed. Okay, so symptoms in the partner. If the partner is experiencing any symptoms, such as discharge from the penis or vagina, any burning sensation when passing through, any ulcers. Okay, good. We covered partners. We said, is there any chance you could have had more than one partner in the last 6 months? We already asked, how many partners have you had in the last 6 months? And the symptoms in the partner we have just covered as well. Good. This is because we need to do contact tracing. So previous testing for the patient, if they've ever had any sexually transmitted infections before, if they've ever been tested for STIs, if their partner is experiencing any symptoms, is your partner experiencing symptoms such as discharge from the private parts, pain, or lumps anywhere? The presenting complaint, if it's discharge, you will take history of the discharge early. And when we're doing sexual health, we will talk about that. Now, you need to pay attention to take contact tracing. When we're talking about contact tracing, our history is designed so that we can cover who could have been affected by this person's potential STI. Did you have sexual intercourse with your partner or your wife after you came back from your travel? What kind of sexual intercourse did you have with your partner? Was it oral, anal, or vaginal? And did you have sexual intercourse with anyone else after that? This is a very important part of sexual history. You need to do contact tracing. And so, one more time, I'm going to have a patient who could have presented with discharge from their penis. We want to know about the discharge, its color, its consistency. We want to know if there's any pain on urination. We want to know if there's swelling, itching, ulceration, bleeding. And so we take the initial presenting complaint history as usual. We now have to take some personal history. So I'd just like to ask you a few personal questions about your sexual life. If at any point you find it to be too much, please let me know and I will stop. Is that all right? Yes, that's okay. Are you sexually active? Yes. Is your partner male or female? Female. And do you practice safe sex? By this, I mean, do you use condoms? Yes, I use condoms. May I know what kind of sexual intercourse do you usually practice? Is it oral, anal, or vaginal sex? It was vaginal sex. When was your last sexual intercourse, if I may ask? It was 2 weeks ago. And with which partner was this? Was it a stable partner? Yes, it was a stable partner. And is there any chance you could have had more than one partner in the last 6 months? Yeah. Let me add that for you. Is there, is there any chance you could have had more than one partner in the last 6 months? Yes. Have you traveled abroad recently in the last 6 months? You need to cover 6 months for travel, okay? Okay. And did you have sexual intercourse with anyone while you were abroad? Again, if yes, what kind of sexual practice was it, oral, anal, vaginal? You need to do that. And then you ask, did you use condoms? So the questions, they highlight what we are interested in as doctors. We are interested in whether or not the person could have been high risk for a sexually transmitted infection, and if they could have passed it on to anyone else, because then we would need to recommend contact tracing, which could be anonymous, partner notification, if they don't want to have their identity known. So we ask about if they're in a stable relationship, and we ask about any previous testings before. Have you ever been tested for sexually transmitted infections before? Have you ever been tested for STIs like HIV, chlamydia, or gonorrhea? Has your partner experienced any symptoms such as yourself, any discharge, pain, or lumps in the private areas? Okay. Has your partner ever been tested for sexually transmitted infections? We need to be thorough. Have they ever had an STI diagnosed? The patient may know, may not know. You need to be thorough. Tracing contacts. This is the questions that tell you if this has been passed on. And may I ask, did you have sexual intercourse with your partner after you came back from Thailand or the holiday? Because that's the common story. What kind of sexual intercourse did you have with your partner? And did you have sexual intercourse with anyone else after the unprotected sexual intercourse exposure that we identified in the initial history? So when we do the STI scenarios as part of men's health and women's health, we will go into each scenario deep. Let's talk about menstrual health. Now, commonly we think about 4 Ps: pap smear, pregnancy, periods. Okay, we think about these. Is there any chance someone could have been period? The way we check for pregnancy is, when was your last menstrual period? Are your periods regular? Obviously, any painful periods as well. So how many days do you bleed? How many days is your menstrual cycle? Do you pass clots? Are your periods painful, heavy? When was your last cervical smear? And may I know the results? And if somebody didn't have a last cervical smear, please be inquisitive. Is there any particular reason why you didn't go for your cervical smear? Okay. And do you use any type of contraception? If the answer is yes, you need to know which type of contraception being used. But obviously, contraception, we'll ask because we're already taking a menstrual history, isn't it? But if you do forget to do that, it's also part of medications, contraceptions. Anyway, female history is very important, and it's personal to ask about menstrual periods. It is personal to take a sexual history. It's personal to ask about recreational drugs. What is not personal is smoking and drinking.